So it's about 1:02. People can kind of continue to join us. But for everyone that's here, welcome to the One Health Seminar Series. You may not know that this series is organized by the University of Guelph One Health Institute. And my name is Carrie Shooten. I'm a PhD student here in the Department of Pathobiology, and it's a pleasure to be helping to facilitate this seminar today. Before we get started, I want to first acknowledge that the University of Guelph resides on the ancestral lands of the Attawandaron people and the treaty lands and territory of the Mississaugas of the Credit. We do recognize that this gathering place and all the places we are joining from today are home to many First Nations, Métis, and Inuit people. And acknowledging them reminds us of our relationships to this land where we explore, share, discuss, and learn about our shared responsibility for human, animal, plant, and ecosystem health. Before I introduce our speaker, I'll just reiterate what Catherine just said, that we are recording this seminar, and the recording will be posted to the One Health YouTube channel, and a link will be available on the One Health website after this. And it may also be used in the context of promoting and showcasing One Health work being done on our campus. So if you do have any questions or concerns about the recording or questions about the One Health Institute in general, you can contact us at onehealth@uoguelph.ca. And then at the end of the seminar, we've organized it so there'll be lots of time for questions and discussions. So you can please feel free to ask questions either by raising your hand and I'll call on you in turn, or if you'd be more comfortable, you can type those into the chat and then I can ask them for you. And it looks like we've got a nice crowd now, so it is now my pleasure to introduce our speaker for today. Dr. Maya Goldenberg is an associate professor in the Department of Philosophy at the University of Guelph, and her research is in philosophy of medicine, sciences and values, bioethics, and women's health. And she is also the author of Vaccine Hesitancy, Public Trust, Expertise, and the War on Science, as well as many other journal publications. And today her talk is titled Vaccine Hesitance, Science, Publics, and Democracy. And we're really thrilled to have Dr. Goldenberg speak on this important and really complex topic as part of our 2022 seminar series. So without further ado, I will mute myself and you can take it away, Dr. Goldenberg.
Thank you. Thanks for that introduction, and thanks to everyone who's here and for the One Health Institute for inviting me to be part of this. It's a pleasure to be here. So I'll just give a little bit of context. I've been working on vaccine hesitancy as an area of research for a number of years. I think I looked back. I gave my first conference talk on the subject in 2014, which eventually led to an article publication shortly after. And it only expanded into a book project, the book that was just mentioned, when my research seemed to make things more complicated rather than resolving it. And even now, you know, I'm at the nearly a 1-year mark after the book was published. This would be a nice time to steer myself in other directions, but the topic just keeps going. It's not something that's going to I'm not saying it needs to be resolved, but it keeps changing. And I'll be speaking a little bit about the political currents that keep changing vaccine hesitancy and responses and other considerations around that. But I'll start with a broad claim, and then I'll get a little more specific. These are the two takeaway points from my years of research on vaccine hesitancy. The first is that trust is key to successful public health interventions. And the second is the but scientific institutions, I mean both research institutions and governance, need to earn trust rather than expect it. So lack of trust rather than lack of scientific understanding is what lies behind vaccine hesitancy. And I'm going to explain soon how lack of scientific understanding is what's commonly thought to characterize vaccine hesitancy, to be the cause of it, but I don't think that actually properly captures what's at the root of vaccine hesitancy. So let me just say a bit about that first point. That trust is key to successful public health interventions. I think people generally agree that the public needs trustworthy science in order to make informed choices about everyday issues, what to eat, how to live, what political policies to support or oppose. We rely on experts. We rely on scientific advice all the time. But What's less appreciated is just as the public needs trustworthy science, science needs the public's trust too. And this is true in all areas of science. Our scientific institutions are generally publicly accountable. They need public funds, they need tax breaks. Sometimes researchers just need to be left alone to do their work. So the public needs to trust that scientific institutions deserve these public goods. So this is all to say that public institutions have an interest in being trusted by the public, to be seen as working in the public interest. Now, public health is an easy example of science needing the public trust. You really can't fulfill community health goals if no one follows the recommendations. For example, you can have great vaccine directives, but if no one follows them, public health is undermined in that respect. Now, I didn't start with this idea that trust is the key glue that brings science and the public together and makes many areas of science operate well. When I started this investigation into vaccine hesitancy, I had a different idea. I now see that I was steeped in what is called the knowledge deficit model. I hadn't heard this term before, but once I did hear it, I said, oh, okay, that was me. So I'm going to define that for you. Now, many people were asking, including me when I started this research, why would anybody hesitate about vaccines? This was back when pediatric vaccines were the big object of study and worry. Why would anyone hesitate about these vaccines that have a strong scientific consensus? Some of them have decades of use, so the long-term data is there. They have strong endorsement from experts. And this assumption that is commonly made is that there must be some missing piece of information, some key scientific understanding that is keeping the public from feeling confident about vaccines. It's a knowledge deficit that's holding them back. And in science communications research, they use this language of knowledge deficit. There's some gap in your knowledge. If we can find that gap, fill it, then everything should be fine. So when that question is asked, why don't the public follow the scientific consensus about vaccines or about many other things? Why don't the public follow the scientific consensus all the time? Science illiteracy is a popular answer. It must be something with your understanding of science. Similarly, during our pandemic, where we can't have the certainty of consensus, long-standing consensus claims, we ask, why are public health measures during this pandemic so fraught? Misinformation, that must be the answer. Misunderstanding and misconceptions about science, that must be the answer, and that is the popular view. So in all of those answers, science illiteracy, even science denial, we're assuming that there is some knowledge deficit there. Even when we ask questions, what's it going to take to convince these people? What more evidence do they need? We're assuming that there is a gap in the evidence that's needed. The knowledge deficit model is also fueling that view that misinformation is the cause of poor pandemic response. So that's what people think. This is all to say that there's some key misinformation that is somehow missing. And of course, it seems like a good explanation in many respects. People who don't accept the science must not understand the science. And there is lots of examples of this knowledge deficit explanation for public resistance to scientific claims. So this is all to say, if it sounds familiar to you to say, oh yeah, it must be that people don't understand science, it's because you keep hearing that again and again in the media, in academic investigations too. So I just put two examples on your screen here to look at, where you know, just by the headlines alone, you can see how the problem is characterized. Why is there a measles outbreak? This was some years ago, 2019. Well, it's an outbreak of science illiteracy after all. What is stirring debate and controversy during the pandemic? Neil deGrasse Tyson says it must be misconceptions about science. That's got to be it. And that is the knowledge deficit. There's some deficit of scientific knowledge and understanding. And that explanation carries in how science and health communicators respond to vaccine hesitancy. When you look at the resources that are put out there, let's call it vaccine outreach, trying to convince the public that they should vaccinate, whether against flu or for their kids vaccines or against COVID, it seems that the characterization is always, here are the facts, let's educate with facts, let's debunk myths. And just about all science communications look something like these examples I put on your screen, just the facts, facts versus myths, myth busting, because if we could just eradicate the myths, if we could just bring in new facts, presumably everything would be fine, the deficit would be filled. So the deficit model, that's a tied-in assumption to the deficit model, is that once properly educated, the public will come to see the science-based issue the same way that experts do, and the controversy will then disappear. Of course, it doesn't disappear. The controversy doesn't just disappear, no matter how much information is put out there. I'm going to come back to the Freedom Convoy at the end. Now, back to that question, why do we hesitate about vaccines? When I started investigating it, I found lots of reason to think that science illiteracy is not the problem. Here's a few reasons. One is that there's a lot of social science about who are vaccine refusers, what are their characterizations, their education level, socioeconomic status, that kind of thing. And it is noticed that many vaccine refusers are highly educated. This was more the case with pediatric vaccine refusal. It's shifted a little bit around COVID vaccine refusal, but I'll come to that. So when I started doing this work, the characteristic vaccine refuser for pediatric vaccines for their children, vaccine refusers in industrialized nations, I should limit that to say, in places where vaccines are widely available and accessible, the common vaccine refuser was an educated, affluent, white, urban mother who had children a little bit later, so an older mother. The profile has changed a little bit, and we can talk about the political shifts that have reshaped the characteristics of vaccine refusers during the time of COVID. However, this characterization of pediatric vaccine refusers, at least for now, until we go back to studying this, seems to hold. So these educated vaccine refusers, they do their research. They even read primary source literature in order to construct informed views and arguments. So against that theory that vaccine hesitators and refusers don't know the science, many of them read a lot. And they use their critical thinking skills, the kind that one gains through higher education, to allegedly read between the lines. They claim to know what's really going on. They claim to know what the establishment doesn't want us to know. So what's really going on? They have an answer for that. They say, look, it is profit. There is profit-driven interest to increase vaccination rates. That's a common view among vaccine hesitators in Canada, in the US, across Europe, Australia. Those are the industrialized nations that I'm most familiar with the data there. In order to boost profits for vaccination, you'll have scientists and government and agencies covering up uncertainties or harms, overstating the benefits, undermining safer natural alternatives, and of course, bringing nonprofit and government agencies on board to promote the consistent message in favor of vaccination. That is a very common view. And there's a lot of survey, I mentioned a lot of survey and interview research into vaccine hesitant parents. Their apprehensions about big pharma really loom large in their vaccine decision-making. I'm trying to say this is not a side issue. This is a prominent issue. And as I mentioned, I saw the same kind of same comments were being made in interviews with Canadians, Americans, Europeans, Australians, okay? Now, missing from this research into vaccine hesitancy, so I'm referring to social science research into interviews and surveys of vaccine hesitators. Missing from this research was attention to how race impacts vaccine attitudes. At the time, there was good reason to think that racialized people would harbor more negative attitudes towards vaccines compared to non-racialized persons. And I think the good reason to think that was known, that it is well known that there is lower trust and less willingness to participate in healthcare systems by racialized people. They don't trust the system in general. But at the time, scientific misunderstanding was still presumed to be the determinant. And because of that, race was not properly studied as a factor in vaccine hesitancy. Most of the survey research, from what I could see, and I think I saw a lot of it, most of the survey research was done on white participants. Now, it was only when focus was turned to COVID vaccine hesitancy. So, circa early 2020, there was a lot of money put into COVID research. So there was a flood of social scientists and even not social scientists, but people who put projects together. They wanted to survey COVID vaccine hesitancy. And it was there that this assumption that race is not a determinant was corrected. In this case, researchers bothered to ask racialized people and communities, and they found significantly more ambivalence about the COVID vaccines. This is before the vaccines were even available to the public. It was great that this was known because it allowed for COVID vaccine outreach to do more targeted outreach to racialized communities in culturally sensitive and even trauma-informed ways. That was a good thing that came out of COVID vaccine outreach. Now, what can we do? What do we do about vaccine hesitancy? Well, there's two ways to deal with it. One is persuasion, and the other one is regulation. I'll start with persuasion, then get to regulation. Of course, there's interest in getting people vaccinated. It's not just an individual choice. We're talking about community protection. So there is at least at face value, there's a good reason to try to convince people, not coerce, but at least convince people to try to get vaccinated. Of course, persuasion is difficult, as any health communicator will tell you. It takes time. There are lots of cognitive biases that protect people's prior beliefs. So if you come in not sure about vaccines, it's hard to change your mind. It's really hard to change people's minds. So some frustration at how slow these measures work is understandable. It makes a lot of vaccine advocates impatient, and it makes a lot of them think that we need to do something other than persuasion, that we need regulation and, of course, enforcement of those rules in order to really cover the ground that we need. So I'm going to stay with pediatric vaccines before I get to COVID vaccines. In the 5 years that I was studying it prior to COVID vaccines taking over the research landscape, persuasion techniques really didn't change very much. It was the same infographics that I showed you on the screen earlier, just the facts, myth busting, that kind of thing. Most of the sort of energy and intellectual innovation went into changes to regulation to counter vaccine hesitancy. That's where the movement was. Now, there are reasons for this, that people were more interested in vaccine mandates than vaccine outreach through persuasion. One is public health is underfunded. Another one is there's behavioral science research telling us that so far no persuasion techniques have really had much impact. So those findings, of course, may be used to further justify not funding persuasion research and outreach as something that maybe is a lost cause. Some people take that negative view that is a lost cause. Now, what we can do is enforcement of regulations. So let me just show you what enforcement looks like. This should be familiar to you. This is the vaccines that are required to put a kid in daycare or school in Ontario. These have been in place. They've changed a little bit, but these kinds of vaccine requirements or vaccine mandates for school entry have been around since 1982. To attend daycare, you need to be vaccinated against meningococcal disease, pertussis, varicella, diphtheria, tetanus, polio, measles, mumps, rubella. New Brunswick is roughly the same. Manitoba only requires vaccination against measles, and the other provinces do not have strict requirements around that. But here, I want to go back to thinking more about regulation. So yes, provinces like Ontario have vaccine requirements. I don't always use the word mandate because it can get confusing, because although it is required to state your vaccine status, there is no sense in which children are mandated to vaccinate. They need to state their status, but there are exemption clauses, and exemption clauses are what's really important when we talk about changes to regulation. We have medical exemptions and non-medical exemptions, whether religious or personal belief, and they are the same. So I mentioned, whereas persuasion techniques kind of stayed the same in the 5 years or so that I was watching, there was a lot of movement in those years around vaccine regulations, not just in Canada, in other countries. Every US state has vaccine requirements, and they each do it differently. So there was great research opportunity to track vaccine uptake as legislators either tightened them up, so they made it harder to exempt a child from school entry vaccination, and in other places they loosened up the requirements in order to appease voters who refuse vaccines or object to vaccine requirements. California was probably the most severe. Actually, Italy too, at some point, they removed all non-medical exemptions altogether for children to go into daycare or school. So there are many negative pressures to vaccinate. So although we call them mandates, it's always you need to vaccinate or suffer consequence. So you do have the option to suffer the consequences. One of them might be homeschooling your child is a consequence of that, but other kind of negative pressures are children who are allowed to go to school may be barred from school during outbreaks. That's been fought in courts. It has won every time. It is considered a legitimate public health intervention to bar children from school during an outbreak. In Australia, you will lose your child benefits if you don't vaccinate. There is, of course, the ubiquitous public shaming of so-called anti-vaxxers. We've heard cases of physicians kicking patients out of their practices for refusing to vaccinate. There are lesser severe, let's call them bureaucratic hurdles to make it harder to get vaccine exemptions in order to get work around school or daycare entry requirements. Of course, for COVID, freedom of movement is often restricted for unvaccinated people. You need a vaccine passport, as they're called in some places, to come to campus, to eat at a restaurant. Those are the negative pressures that are meant to nudge people towards vaccinating, because life will get too hard if you don't. That's the idea there. Now, the strongest proposal has, of course, been to eliminate non-medical exemptions. This is back to pediatric vaccines. Where the kinds of punishment can be fines, jail time, and of course, refusal to allow children into schools and daycare. California's example of this, they did this in 2016 following this highly publicized Disneyland measles outbreak. Italy did this in July of 2017 because they had measles outbreaks in the tens. Each outbreak was in the tens of thousands. It wasn't anything like what we saw in the US or in Canada. So in this case, you can only have a doctor's note, a medical exemption to not vaccinate your kids. And there were serious fines and other kind of negative consequences if you didn't. Now, there was pushback on this. In California, they noticed as soon as they got rid of non-medical exemptions, there was an uptick in the number of medical exemptions being given out by physicians. So they needed to pass additional law to control how medical exemptions were being given out, because it seemed like some doctors were just writing them for anybody who wanted it and making a lot of money doing that. So all these measures were introduced in times of trouble, it's worth saying. The strictest enforcement is done when there's a major measles outbreak in these cases, and the public are galvanized and wanting change. So the political will is there. So there is, of course, an ethical imperative in public health where you want to balance individual liberty and collective good. And at least in this case, is during times of outbreak, the ethical arguments seem to permit strong enforcement because public health was under such threat during these outbreaks. Now, compare that as a strict view to Ontario, where if you wanted to exempt your child now from daycare and school exemptions, you need to print up an exemption waiver, which is easy to find on the internet. I've gone through the exercise to do that, not to sign it, just to find out how easy it is. You need to get it notarized, which is a signature from your MP or MPP or any notary, really. In 2016, there was a worry that too many parents in Ontario were exercising this option, so they added a few extra bureaucratic steps. You needed to go to your doctor for a signature and a conversation as well. And in 2018, they added another hoop you had to jump through, which was public health agencies had to offer education sessions, and parents who wanted an exemption needed to attend one. It was usually watching a video, and then a public health nurse would come in the room and say, do you have any questions? So here's how they went. This is, first of all, is the statement of conscientious objection. In Ontario, this is what you would have to sign to exempt your child. And of course, this on your left here is a news article telling us just how well those education sessions introduced in 2018 had gone. They apparently convinced nobody, 0 conversions. That's what the article reported. This was less than a year into the new program. Parents said that they found it irritating and patronizing to need to watch this video. Now, that is not necessarily a loss. It might have not been the point of these education sessions to convert anyone. If it did, that'd be great, but that might have not been the objective. It's all about making it harder to do. That's a classic behavioral technique to make people less likely to participate in undesirable behavior, increase the cost of that undesirable behavior, and people are less likely to do it. Okay, so in my work, so you know I'm a philosopher, and I get to bring different interests and skills to this problem than social scientists and policy researchers looking at vaccine hesitancy. Most of the work is being done by behavioral researchers in public health schools. Excellent work in my opinion, I mean across the board, but here's a chance for, you know, an interdisciplinary, here's an interdisciplinary opportunity where you can find out what, you know, differently trained researchers can bring. So I work in this area of philosophy called epistemology. It's the branch of philosophy that's interested in knowledge. So we look at questions like, how do we know what we know? Are our knowledge claims justified? My focus is always on health and healthcare. I ask those questions about health claims. How confident can we be in, let's say, the latest published research? How are majority views established in science? What happens to dissenting views about health issues? And of course, what about controversial health issues, especially not just within the scientific community, but within the public sphere? So with that, I changed my research question from the knowledge deficit informed question, what's wrong with those people? Why don't they understand vaccine science? To the question, why is there reluctance to accept the scientific consensus on vaccines? And there are many reasons, is the answer. This is from a report from the American Academy of the Advancement of Science. And here are, looked at a lot of literature and polling, and these are the things that parents say. These are the myriad of reasons. Now, some of them do sound like science illiteracy. I'd say the first 6 or so sound like it when they say vaccines are not necessary, vaccines are not safe, they're ineffective, focus on side effects, even though we know they're very rare. Those kind of claims, when made by non-experts, seem to overstep the bounds of expertise. You are making claims about science while lacking expertise about vaccines or about infectious disease in order to ground those claims. People who are non-experts do not have the knowledge and expertise in order to challenge technical and scientific issues. Of course, some of the reasons parents give point to outside influence, maybe lack of critical thinking, but of course influenced by social media and, yes, misinformation. Now, we know that most parents, especially these parents who are educated and are really trying to do what is best for their children, they spend a lot of time on the internet. They are very likely to encounter vaccine misinformation, and misinformation, according to the studies, they work. It shows that even 5 minutes on the internet can really destabilize vaccine confidence. Now, there have been the introduction of technological solutions to try to help this, adjustments to Google search algorithms. Facebook now flags and identifies fake news, media literacy efforts too. But before we blame the sources of misinformation, we might also ask why people visit vaccine skeptical websites at all. These educated parents are presumably aware, as many of us are, of the varied quality of internet information. And the scientific consensus is really uncompromising in its messaging regarding pediatric vaccines. So why isn't that enough? This is the point when media commentators usually throw up their hands and say, oh, anti-science and science denialism. They wonder why the questioning public don't believe in science. Now, there's this whole genre of popular science books and blogs and TED Talks that talk intensely about science denialism. And the tone can be really vicious. They talk about idiots, how these idiots are a threat to society. There's jokes about survival of the fittest when unvaccinated people die of communicable diseases. It's not nice. And it's very polarizing. There's definitely an us versus them, we the people that know and those that don't. So why that tone? Why that kind of vitriol? It's because science is thought to rationalize democratic choice. Okay, science is supposed to be what makes democracies reasonable and functional. We need science in order to inform our policies, in order to make good choices. So denying science is deeply threatening to our futures. That's why people are not calm about science denialism. When science is questioned by misinformants, science becomes partisan. You deny it or you believe it. And of course, that's not what science is supposed to be. Now, our politicians have done a lot to invigorate this kind of science partisanism, even the people that support science. It started with former President Barack Obama, or at least my reading of it, when he, in his inaugural speech, he said, "I believe in science," and the public loved it, probably because the previous president, George W. Bush, was a notorious anti-science president, second only to later President Trump. Prime Minister Trudeau similarly claimed allegiance to science. In 2015, he installed a new ministerial position, the Minister of Science. And like Obama, he was responding to the previous prime minister's anti-science views. I'm referring to Harper. So believing in science, this kind of politicized or partisan language where you believe in science, is now the language of Democrats and liberals. Most recently, Joe Biden campaigned and won a platform that included bringing science back to the White House. There were all kinds of stickers that said, "Let's bring science back." And his response was also well received and meant to distinguish himself from his opponent, who was, the one more anti-science president than George W. Bush was. If you remember Trump's early in the pandemic, Trump's aides bragged that the president was going to take the USA back from the doctors. So just like your political positions on social issues like gun control, abortion, or gay rights, science has been similarly characterized that way. So let's pause for a minute and think about the framing of the dispute. Is that between science believers and science deniers? First, science is not a belief. When it's done well, it's our best means for understanding natural phenomena. As for deniers, vaccine skeptics, for the most part, they do not reject science per se. So I'm opposed to the idea of science denial here. They don't reject science per se, but rather the language conveys that they challenge the trustworthiness of science governance, how research is prioritized and funded, how trials are designed and evidence is collected and analyzed, which studies get published, and how scientific evidence is used to inform policy decisions. These critics, they charge scientific institutions with bias, say for having financial interests that work against the public interest, for not listening to the concerns of the people. That is the more dominant theme in vaccine hesitancy and refusal. Now let's try to link public trust in science with democracy, because that's important. Our democratic structures are actually important to how science is being played out in the political arena. Now, we know that the science consensus, when we have a consensus, or at least let's call it some kind of convergence, if a consensus has not been achieved yet, it is the collective judgment of the community of scientists who are best equipped to know the answer. So the scientists in a particular field of study. And consensus statements capture the state of general knowledge within the field. They can often done to inform practice or policy, or even to educate the public on important matters like climate change. And consensus statements, they of course, they earn their legitimacy through their methods, through rigorous debate, through scrutiny by expert communities of scientists. Those kinds of methods include debates and negotiations in expert journals, at academic conference setting, peer review, sometimes replication of findings. I'm not telling you anything you don't know about how science works. But from the public's perspective, it's worth noting that these mechanisms that are used to ensure the trustworthiness of this information, of the consensus, the information grounding the consensus claims, they are internal to the scientific community, and therefore they're largely shielded from public view. The public is expected, they're even implored to trust the source. Most members of the public are willing to do this, despite being largely unable to judge the contents of the consensus statement and not very knowledgeable about how the consensus was reached. Non-experts often choose to trust the consensus as scientifically accurate and to trust that the information has been conveyed honestly. Now, when members of the public challenge the consensus view, I'll say it again, they are not rejecting science, but they are rejecting the integrity of these kinds of consensus statements. They do not trust the source, and they thereby question the contents of the consensus statement. Now, we all trust, on matters of trust, there's lots of study of who do we trust and why. We tend to trust the people who we perceive to have our best interests at heart. If we don't find that in our family physician, who might dismiss our vaccine concerns and shut down discussions, we will turn to family, friends, online communities of like-minded people. This isn't a speculative claim. This is a common story among vaccine-refusing mothers. I started with a visit to my pediatricians, and things went badly from there. I was shut down, made to feel stupid, and so on. So a lost opportunity there, and that's what often gets people more radicalized about vaccines. Now, trust is not only extended or denied to people that we know, but also to professional representatives like public health officers. And we even can talk about trust in institutions that these professionals represent. So people will say, I trust Health Canada, or I trust information from the CDC. It's not a discordance between people who trust each other and trusting in things or bodies. Public institutions, of course, need to be trustworthy, but they also need to be recognized as trustworthy by the public. We call it credibility in epistemology. Those words are usually used interchangeably in common language, but we use the language of credibility to say the perception of trustworthiness by others. If public health is not seen as trustworthy by the public, it cannot fulfill many of its mandates, pretty much all its mandates, to safeguard public health and well-being. So I understand vaccine hesitancy to be a symptom of poor public trust in scientific institutions. And I want to argue that earning and maintaining the public trust is crucial for fulfilling public health mandates. And many of the things that scientific institutions, of course, want to do relies on positive public relations. As I mentioned, if you want the tax breaks, if you want to be left alone, and of course, if you want the public, this is especially the case for policy relevant science, if you want the public to respond and build on your directives, you need to be trusted to do that. Now that gets me to my second point of the two main points. One is that scientific institutions need to constantly earn and maintain trust rather than assume it. Sociologists and historians of science tell us that there was once a time when a white lab coat conferred a lot of instant authority on the speaker. Times have changed since then. Persistent vaccine hesitancy, of course, indicates some level of institutional failure to capitalize on public trust. It's a failure on the part of experts and expert institutions, not entirely all in the fault of it, but it's something that was not achieved. While most of the attention is usually conveyed on the moral failings and the epistemic failings of the public, I want to redirect attention to what should have been done to elicit that trust rather than attention on those who failed to give it. Okay, I'm just going to wrap up, draw some conclusions here, and then try to bring it to COVID today. Okay, so what I've argued here is that the evidence most of the publics accept on vaccines turns crucially on trust in experts. It is poor trust in expert sources that breeds vaccine hesitancy and refusal rather than scientific denial or scientific misunderstanding. Even very strongly supported consensus claims will not convince anyone if the sources are not perceived as trustworthy. So to confront public resistance to scientific claims, what if we focused on building that trust rather than educating the misinformed public or puzzling over the moral and epistemic failings of the public? Doing this, of course, doesn't discount that public health agencies may have the science on their side, but it does mean that we need to recognize that the best science is not enough. It needs uptake too. And that's where even the best science is not necessarily going to give us that end. So scientific evidence, I'll say a little bit about science and values, which is a huge area of study in philosophy of science. Scientific evidence operates alongside many social influences that guide personal decision-making and policy formation. A good trust relations ensure that science can stand prominently within policy frameworks. So good relations with the public really need to be maintained. Now, that's my analysis of the situation, but I think there is one lingering question, and it's a big one that I'd like to address before I stop. How much is what I'm arguing here? How much is this call for more publicly responsive scientific agencies and institutions going to help with something like this? You know what this is. Bringing this to our contemporary, looking at the freedom convoy that's clogging up our borders and has Ottawa under siege. Of course, there are a lot of political and ideological interests converging on this so-called freedom convoy. My recommendations to make science more palatable to the public might seem small in comparison, but the credibility of science actually does play a part here. Just this morning, I was listening to a radio recording of Monday's showdown in the House of Commons. So there was public health restrictions was the focus of the argument. And we had the interim opposition leader, that's Candice Bergen, who was strongly demanding answers on when Canadians would see vaccine mandates and other public health guidelines removed. And the response, it came from the government House leader, that's Mark Holland, was science. Science was the answer. He said, we need to follow science using evidence, not politics. The assumption being that what they're doing is following science, and anyone who opposes, including the folks here in Ottawa, are not doing science. Now, I've been arguing that science sits precariously in politicized issues, especially in democratic regimes. I think most of us have, 2 years into the pandemic, most of us have gotten tired of hearing political leaders say, we are following the science on COVID response. The science is often not settled, especially at the start of a new pandemic. It continues to evolve, and it can be selectively used to support opposing policies. I'll also add that science doesn't tell us what to do. It guides. It is not a policymaker. Now, that's not a problem with science. Everything I said, that it can be selectively used, that it's not settled, continuing to evolve, that's not a problem with science, but a problem with how it is used in the public and political spheres. That's where attention needs to be on. Now, so why do politicians point to science at all when they are asked political questions like, when are you going to end restrictions in Canada? You'll recall that science rationalizes political decisions. It's supposed to guide good governance without undercutting democratic choice. So this is another way of saying it doesn't matter what the federal liberals need, what the federal liberals think, it's science after all. Furthermore, the public, or the demos, is supposed to want science-informed rule to get it right, with legitimation, democratic legitimation, of course. A science-informed democracy is presumably the best choice right now over some kind of, say, science authoritarianism on the one hand, or rule by the populist mob on the other. And that kind of makes sense. I think most people would agree to something like that. But when public trust in science wavers, science itself can be politically weaponized. It becomes easy to draw the conclusion that science is being used as a political tool. It's being used by power-hungry politicians with anti-democratic intentions. Why not? If science is already suspected of being financially conflicted, racist, and more, if science is already perceived as poorly governed, why not attach a new nefarious agenda to science? And that is what we're seeing right now in Ottawa and elsewhere. Of course, these are not the scientific ideals and aspirations that many conscientious scientists hold. If science is supposed to be a positive force for human, animal, and environmental betterment, it is imperative that the public sees science this way too. Okay, I'm going to end there. Thank you very much.